Okay, so I'm not sure why my video cut off halfway through my lecture video, but I'm going to do a part two of part two here to finish up through the rest of the slides for chapter 9. So, tuberculosis is an infection caused by a bacteria. It's primarily seen in alcoholics, prisons, individual or immunocompromised individuals. So, it's a very easily spread bacteria when people are especially in close quarters. Symptoms of active disease include blood and sputum, weight loss, night sweats, fever, chest pain. You have already or will complete a PPD skin test. It's a intradermally injected skin test that is looking for a raised site within 48 to 72 hours afterwards. If it is raised, that's a potential positive, so they'll send you for a chest x-ray to confirm. If you have a regular non-drug resistant strain of tuberculosis, typical treatment is about 9 to 12 months of antibiotics. If you have a multi-drug resistant tuberculosis known as MDR-TB, it is highly resistant to most antibiotics. It's very difficult to treat, and treatment is typically 18 to 24 months on that. So that's one of the obstacles for patients to remain compliant or adhere to their course of therapy because of the length. The amount of drugs they're taking, side effects of those drugs, but it's really, really important that individuals that are diagnosed with tuberculosis finish out those courses of therapy no matter how long they are. There's many different side effects for the medications, everything from hepatitis, liver toxicity to changing the color of bodily fluids or discoloring the body fluids of urine, tears, sweat, and things like that. Histoplasmosis is a fungal infection. It's a fungus that's found in bird droppings, typically in like the Pacific Northwest, places where it's more moist. The infection is started when the individual inhales the spores, which cause bronchial inflammation. Typically, they have like flu-like or cold-like symptoms. It's usually self-limiting, meaning your body will fight the infection off. The disseminated version of this, meaning it has spread through a systemic, has gone into your bloodstream, that type of thing, is usually fatal, especially without treatment. So in that case, we would get very aggressive with treatment and probably give them some IVs of amphotericin, which is a injectable antifungal medication. In southern Arizona, we have what we call valley fever. It is a fungal infection. It is inhaled through spores as well. The spores are in our dirt and in our soil here. If you've been in Arizona for any length of time, you've probably already had been exposed to valley fever. It presents very much the same cold, flu-like symptoms, but your body typically fights it off, and then you don't get it again after that. Common colds are mild self-limiting viral infections, meaning you are not going to get antibiotics because they are viral infections. The only time you're going to get any type of antibiotic treatment would be if you had a secondary infection like bronchitis or a sinus infection or an ear infection that kind of came on at the same time as the cold, because your body was fighting off the cold. It allowed that opportunistic bacteria to get in there and cause a secondary infection. Allergies are a state of sensitivity induced by an exposure to a particular pathogen. Some of us have allergies, some of us don't. Some of us have more than others. Some of us are allergic to certain things and not others. So it just really depends on your body's response. Remember, it's the release of histamine in your body that causes the symptoms of allergies. And those symptoms can be coughing, itching eyes, watering eyes, runny nose. Treatments of cold. So this is your role as a pharmacy technician. You will be directing your customers to the over-the-counter cold remedies. Now, it says remedies. It is not a treatment for the cold itself. You're treating the symptoms of the cold. So antitussives using for the cough, so anti-cough. Expectorants like guaifenesin is used to get the mucus out, make your coughs more productive. Decongestants to dry up all that excess mucus, especially in your sinus cavities. Antihistamines are used as well. So prevention of colds, okay, we're really seeing this more. So now with COVID-19, washing your hands, social distancing, using a mask, it's really, really important that you're still following those guidelines. You know, Arizona is continuing to creep up in the cases. So anytime you leave the house, you should be wearing a mask, not only for your protection, but the protection of those around you. Washing your hands. You don't need to wear gloves. Just make sure that you're washing your hands frequently, that you're wiping down certain surfaces like your cell phones, doorknobs, handles, things like that, the grocery carts, when you go to the grocery store, anything that you're touching, okay, make sure you're doing that. So on slide 40, you see the list of antitussives that are used. I'm not going to go through that. I want you to look at that chart, but there's different versions. Some of them are controlled substances, others are not. Expectorants, so guaifenesin, Mucinex. So again, it's that little green goobery guy in the commercial. Excuse me, it loosens up the mucus, it thins the bronchial secretions, which in turn make your coughs more productive. So we're getting out that, we're coughing out that mucus. I have the hiccup, sorry, excuse me. Side effects, typical nausea, vomiting, GI upset, can cause drowsiness. So decongestants, these would be your pseudoephedrine containing products. So we know that pseudoephedrine has a strong abuse potential because it is used in the illegal manufacturing of methamphetamine. We must keep it behind the counter. There's federal regulations on how much grams per day and how much grams per month an individual can purchase, and there's only oral products available. So your first generation antihistamines, so there's 3. These are the very first 3 antihistamine medications that were developed and brought to the market. Benadryl is one of those. That's the most common one you're going to see from this list. We still use it today. It's an over-the-counter item, and a lot of people use it for a lot of various reasons. Your second generation would be the newer ones out, Claritin, Allegra, Zyrtec. Those are the second generation. They were developed on the basis of the first generation and how we can make those different. So that's why a lot of these have a non-drowsy 24-hour formula that allow our patients now to take them during the day so they get that day relief. Nasal corticosteroids, so we're using these nasal sprays for any inflammation that we have in the sinus cavity. The nasal spray goes directly into the nose. The corticosteroid works to reduce the inflammation within the sinus cavity, also makes breathing a little bit easier. So smoking cessation. So the effects of smoking on your body, okay? It damages the airways and the alveoli. It increases your risk for heart disease, heart attack, stroke, diabetes. It can cause reproductive difficulties, bone health issues. So obviously, the sooner you stop smoking, the longer life you're going to have, the better health you're going to have. Nicotine is the addictive component of tobacco. It's absorbed into the lungs through the cigarette smoke, or it's absorbed into the oral mucosa when non or smokeless versions of tobacco are used. Use my dogs. So things like the pouches that they stick into their gums, or things like that. So to stop smoking, they're looking at things to do nicotine replacement. So you're looking at things like patches and gum, behavior modification. So changing your routine if you're a smoker to get out of those habits. Smoking cessation therapy, again, smoking supplementation, so patches, gum, Wellbutrin, which is the brand name for bupropion, that's used. It helps with the mood changes and the emotional instability that's associated with people that are stopping to smoke. It also helps reduce the cravings. Chantix is one of the newest ones out on the market. It works really, really well. It's one of the best ones that they have out there. It works by reducing both the severity of the cravings and the withdrawal symptoms. So it helps people be more successful in quitting. Last slide. So, complementary and alternative therapies. So, herbal supplementation, Boswellia serrata. This is a powdered form, which is from the plant resin itself, and people will use it in its powder form to help treat inflammatory diseases such as asthma. Choline, which is related to the B vitamins, that's also used by individuals to help treat asthma. Yoga. Yoga is used to improve the symptoms of both mild to moderate asthma and COPD. And then nasal irrigation. So a lot of people, especially when they're suffering from allergies, they will use things like neti pots. These are used to clean out the nasal cavities. You want to make sure that the irrigation system or the neti pot itself is clean. Always use sterile water, but it works really well to flush out the whole nasal cavity system and get those allergens out, excess mucus, all of that. So it works really well. And that finishes chapter 9.